We're back now with two former employees at Chesapeake Regional Medical Center speaking out against the hospital.
They say they warned their bosses about unnecessary procedures done by convicted OB-GYN Dr. Javaid Perwaiz. Only on 10, our Kevin Rahm has their story of the troubles they faced afterwards.
Good morning.
When I really started to take note of who he was is when I noticed the influx in surgeries on Fridays and particularly Saturdays. We would get a list on Mondays of all the planned surgeries for the week, and I would plan staffing accordingly for those surgeries because my unit received all the urology, GYN surgeries, but that surgery schedule would change last minute. There would be a lot of add-ons. It would go from 6 to 12 patients, and that's when I realized something was wrong. The more I pushed leadership, the more pushback I got.
When patients are admitted, they're either inpatient or outpatient. And what I found almost immediately was that a lot of his patients had a really high acuity, which means they had enough things going on with them medically, they had enough comorbidities, or they had a procedure that was performed on them that should have had them placed as an inpatient. But my concerns were sort of peaked when I would reach out to Dr. Perwaiz, and as courtesy, he's a physician, I am a nurse. This patient should be flipped to inpatient, and he would refuse.
I remember sitting in a lot of leadership meetings, and it was always directed around finances and money and how can we do better to make more money so we can fund this project and this project. When I would look at our budgeting and the finances each month, because that is something that I was responsible for doing, I noticed that it paid more if you charged for an outpatient in a bed.
And I can tell you it was sometime in that first year I started keeping an Excel spreadsheet of patients who, based on medical documentation and our guidelines should have been inpatient, of Dr. Perwaiz's, that he would refuse to allow me to flip. So I started gathering that information. And I think when I got to like 30 is when I really started having major concerns, and I reported it. And I know that my director did share that information with executive leadership. But what happened is we were told we weren't going to be completing utilization reviews on weekends anymore, that was going to be completed by our supervisor from her home remotely. But I was like, well, wait a minute. Is the reason, and I really thought, is the reason that we're not allowed to review this anymore is because they don't want us to keep gathering this information or continuing to be aware of what Dr. Perwaiz was doing.
Dr. Perwaiz did not do this alone. It all goes up to leadership. Someone had to know.
I know that they knew about this because I told them.
In a statement to 10 on Your Side, Chesapeake Regional said in part, quote, out of the respect for the legal process and the individuals involved, we are unable to comment on the specifics of ongoing litigation. You can see all of our coverage on wavy.com.